voiding of urine. Micturition means voiding of urine. So in the next slide, we will be seeing about empathize part. That is how the micturition is important. Why the micturition is important. That is what we are going to see. So for that I am going to say about a case study. Okay. One patient is almost 70 years old. Okay. He is always wetting his bed while sleeping. He doesn't know that he is urinating. This is what the case. What are the reason for that? What could be the reason for urinating in the bed?
No damage.
Very good. One is no damage. Any other reason? He doesn't have a reflex. And he is aged, so his muscles are relaxed. So that he doesn't know that he is urinating. Okay. So this will happen when you get older. It's a common in elderly case that everyone will get urination. Okay. This is what a case study where I have given it bladder issues or incontinence. Incontinence in the sense he doesn't able to control the urination. His bladder is getting filled. He doesn't know that he is urinating. When he is walking, even the patients will have urinating. The reason is they doesn't have a control of bladder. Then someone will have urine retention. Urine retention means they doesn't urinate. The bladder will become distended, but they cannot able to urinate. These are the different two case scenarios I have given here. And the next one is what the clinicians will do, what the doctors will do. The doctors will start diagnosing. Either it is a neurogenic bladder or an overactive bladder. Okay. Overactive bladder means they have a hyperreactiveness of the bladder. Even a small amount of volume will be coming as a urine. They cannot be able to control. Neurogenic bladder in the sense the nervous control of the bladder is not working. So that he is urinating. So what is the importance of studying this micturition is the micturition reflex will say about the proper bladder emptying and filling. Your bladder will be get distended and it will be relaxing for filling. Filling and emptying of an urine. So now we go to a case scenario that if I was teaching for a long time, for 3 hours, I didn't allow you for an interval break. What are the feelings that you must have? I don't allow you for a break, but you are at a stage of urge to urinate. You can say what you will think in your mind. You can say that, like, what do you feel? And I am not allowing. You didn't ask me also that I want to go for a restroom. I was teaching for a long time. What are the feelings that you will have? No, you tried to use the restroom as much as possible, but I was continuously teaching. I didn't even give gap to talk with you. Very good. First one is irritation. You will get irritated. Very good. Second one is discomfort. Next. Very good. Sometimes you will have a lower abdomen pain. Pain, irritation, discomfort, lack of attentiveness. Your concentration will be fully on the bladder. So in defined ways, I am defining about what is micturition. Micturition is a process of discharging the urine from the urinary bladder to outside of the body. You are voiding the urine out. This process will occur by these 3 phases. One is bladder contraction, external sphincter control and internal sphincter relaxation. Urinary bladder fills. Detrusor muscle relax. Detrusor muscle will send information to sacrum. Sacrum will send information to brain. Brain will send information to parasympathetic. You want to connect? Brain will send information to parasympathetic. Parasympathetic will travel to detrusor muscle. Travel to detrusor muscle. You are controlling the detrusor muscle. Okay. Your splinters will start. Pudendal nerve. Pudendal nerve also will be inhibiting. That is, your pudendal nerve should be not working at the time of voiding urine. Have in your mind when you go hereafter, when you go for a restroom, think your pudendal nerve is not working. Parasympathetic to detrusor. Detrusor to urinary bladder. Brain to parasympathetic, sacrum to sympathetic. Sympathetic. Pudendal nerve to urinary bladder. So you know how to do